Today is January 15th, 2021. We've made it through 10 months of this pandemic in the US, and we've made it through half of January. Yay. So, why do we feel so crappy? For many reasons. So, I wanted to talk today about the fact that the great majority of people I know, whether they're patients, family, friends, they feel crappy. They're anxious, people are fearful, people are scared of going out, and people are unhappy or sad. So this is normal right now. I don't want anyone to think that they're abnormal if they feel unhappy or sad. It is okay to allow yourself to feel crappy for a little bit. And at the end, I'm going to give you a couple of ways I use to help me feel a little bit less crappy during these terrible times. So this year, the pandemic has humbled us. And I would like to talk for a moment about self-compassion. My name is Noha Polak. I'm a progressive pediatrics pediatrician. I've been practicing pediatrics since 1996 in Union City and Bayonne, New Jersey. So basically, self-compassion is when you feel like you are your own best friend. So I talk to myself as if I'm my own best friend sometimes and encourage myself instead of saying, oh, you did this wrong, or you could have done this better, or you should have said that instead of this. I say, oh, yeah, that wasn't the best thing to do or say. Maybe next time we'll do better. I'm going to try to do better next time, as if I'm talking to my best friend. Have compassion for yourself, not just for others. We all need a little compassion these days. So what have I been seeing in the practice in Union City and Bayonne? Basically, I've been seeing a lot of COVID cases. Some of them come into the office for diagnosis and we keep them separate in a separate room. We never use a waiting room, and there's only one room where these patients are allowed to go. And I've also spoken to a lot of parents about their children being COVID positive or exposed to COVID. And I've done a lot of televisits with COVID patients. The bottom line is this: our community has a lot of COVID spread in it. So we all have to be careful. All of the children that have been diagnosed in our practice with COVID have gotten it from their parents. None of them have brought it home from school and gave it to their parents. So COVID has been originating with parents, where parents are exposed to it either at work, while they're at an outing with friends or family indoors, or I don't know where else. Some parents just simply don't know where they were exposed, but usually the parent gets symptoms first, they get tested, they're positive, then we test the child, then they're positive. Those kids that were exposed at daycare or school, the great majority of them are not testing positive when they come in for a test. So I wanted to bring up the point that parents, your decisions are super important to your family's health. Not the decisions you make for your children, the decisions you make for yourself. Where you go, with whom you go, who you hang out with, how careful those people are the most important factor right now to your own family's health. And the other thing I've seen this week in our practice is are that parents are really worried about their toddler's development. A lot of questions about, well, will my toddler be okay because they're not around any other children, they're not around anyone else? And I have to be honest, you're right. Your toddler's development is probably at least a little affected by all the isolation we are all forced into right now. However, there's a little bit of relief using, technology. So bottom line is, you can have your child do a Zoom play date for 10 or 15 minutes where they're simply coloring with another person, whether it's their grandparents or another child. Just parallel play. They don't even have to interact, where there's two people coloring or two people playing with cars or Legos or whatever at the same time. That's still positive for a toddler. So if you can set up a Zoom play date with your child, hey, we all have to do things differently this year. So with pandemic fatigue all around us and all the bad news, what am I using to help keep my mood a little bit better than it would be otherwise. I wanted to be honest. I'm not happy all the time. None of us are. And it's extremely difficult to be happy right now. So, number one, accept the fact that this is a crappy time. Also, don't forget that this is temporary, not permanent. So, the methods I've been using are to think into the future. I put my mind for 10 or 15 minutes into 2 years from now, where we're going to be, where will I be able to go, where will I be seeing my patients, what will I be doing, where will my children be. So distance yourself time-wise. That's called temporal distancing. I've been trying to do it, and it does lift up my mood at times. The other thing is I do talk to myself a little bit about the fact that this is not the first pandemic we've experienced as a human species. We've done this before, we've survived it, we've thrived, we've come through it. This is not the first time that the human race has been through this. It's just the first time that our generation has been through it. So let's be honest and just accept the fact that we're going to survive this. We're going to thrive, and in a couple of years, everything will be great. I hope much sooner than that, but I am projecting into the far future, just to keep my mind in a safe place. The other method that I've been using and trying often is to talk to myself in my own head in the third person. So if I feel myself getting really sad or anxious, I say in my own head, not out loud, thank goodness, Noha, you've done much harder things than this before. You've already made it through 10 months of this pandemic. You have not gotten infected. Your PPE has been working. Your patients have been well. They are responding. So don't panic. So talking to myself in the third person in my head has been helpful to keep my mood and to keep me kind of centered a little bit as to what's happening around us all. And I also tell myself often that I am surrounded by people who are compassionate, who want to help. And that is the truth. The great majority of people out there are willing to help if you simply ask for it. So I'm here to say that if you want or need help, that's where you can come. I will do my best to help you. We can set up a phone call, a televisit, or an in-person visit if you'd like. And we're there for you 7 days a week in Union City and 5 days a week in Bayonne, because we want you to know through this pandemic you're not alone. You can ask a medical question, a mental health question. You can talk to us about just about anything. And certainly we've been fielding so many calls this week about what do you think about this vaccine? And I'm breastfeeding, or this or that. And these are discussions we have to have privately, because the studies have not yet been done on breastfeeding moms or on pregnant women in terms of the vaccine. So it has a lot to do with your level of risk, whether you're willing to take that risk until the vaccine information comes out on that particular group. So I've been having those conversations with parents via phone or televisit to sit down and just assess their risk and what they are willing to do and not to do. So finally, I want you to know that we're there for you to talk, to help you. It's rough out there in every way. So medically, it's rough. Educationally, we're all struggling with our kids trying to get educated. We can talk about methods if you need to, methods to help with that. Thirdly, a lot of our businesses are struggling. If there's any way that my practice can help your business, if there's any way I can spread the word about anything regarding your business, please let me know, and I will do my best to do that. If you've got a flyer, I'll put it in my office if you need me to. If you want me to to share something about your business on our Facebook page, I will do my best to do that after I check it out, of course, for myself and make sure everything is good. And I would like to ask you to please share my videos with other people in our community. And if you have a moment, to please leave us a Google review. We've been trying to increase our presence on the web. And if you have a moment to leave Progressive Pediatrics or Dr. Polak or Dr. Teraguchi a Google review, would be greatly appreciated. So don't forget, you're not alone. Talk to yourself in the third person in your head if you have to get yourself out of the crappy mood. But if you're simply feeling unhappy, sad, or crappy, say, yep, I feel it. It's okay. I don't feel guilty about feeling bad, and it will pass. This pandemic will certainly pass. Don't forget, we're there for you. Call us anytime. Have a great day. Bye-bye.